Hello, everyone. On behalf of the Centers for Medicare and Medicaid Services, the Administration on Community Living, and the Indian Health Service, I would like to welcome all of you to our monthly Long-Term Services and Supports webinar series. My name is Sarah Peterson, and I work for Kaufman and Associates. I'll be the moderator for today's webinar. Before we begin, I'd like to highlight some features of your webinar interface. You can see the PowerPoint slide in the main window, and at the bottom right of your screen is the Q&A box. Today's question and answer period will be at the end of the presentation, but you can enter a question for our presenter at any time in the Q&A box. In addition, if you need technical assistance during the webinar, please enter your tech support question in the Q&A box as well. We monitor these questions throughout the webinar, and we will answer your tech support questions as soon as possible. And you'll receive an answer to your question sent directly to you in the Q&A box. If you'd like a copy of today's slides, please email us at ltssinfo@kaufmaninc.com and request a copy. We'll send them to you by email. And the email address and how to request slides is written down in the welcome box in the top right-hand corner of your screen. Finally, please be aware that today's webinar is being recorded. The recording will be made available online at cms.gov on the Long-Term Services and Supports Technical Assistance section in the near future. With those announcements made, I'd like to thank everyone for being here today. I'll begin by introducing our presenter, Shondine Tracy. Shondine is the Native American Services Outreach Coordinator at the Northern Arizona VA Healthcare System's Rural Health Program. She develops and implements outreach programs and projects related to American Indian cultures, healthcare, tribal governments, and Indian Health Service mission and services. Prior to her work in the Rural Health Program, she worked in primary care as the lead telehealth care technician at the Chinle VA clinic site in Chinle, Arizona, where she provided primary care, mental health care, and telemedicine alongside VA and IHS providers. So welcome, Shondine, and thank you for presenting with us today. I'll turn it over to you now. Shondine, go ahead.
Thank you so much, Sarah, for that wonderful introduction. I'd like to also thank Kaufman and Associates for this webinar opportunity to share what VA has been doing on Native lands. I'd like to first introduce myself in the Navajo language. I'm not quite sure how many attendees are Navajo, but in our culture, we introduce ourselves in the Navajo way. Shondine Tracy, look at and give a nasha. Sanjikin and Michelin, Obaha, Bashichin, Woodna me a dash to J, Dashit me a dash another. Shema a Rita Torichit me, Willia, although she's a Robert Tracy, Willia. Although Shema Sana a Mary Torichit me, Willia, although she a Tom Torichit me, Willia. Chanela has been a Dashitni Nez Tracy Willia, although Chanela is song. Rose Tracy Willia. Yeah. Okay, thank you so much. I'm going to go ahead and continue on here. The title of my presentation is called VA Healthcare on Native Lands. Access to care on Navajo and Hopi nations. Okay, let's go ahead and pause and take a long look at this photo here. For those of you that have grown up on reservations or near reservations, we all know that there's a lot of poverty. There's lack of basic needs, such as no electricity, no plumbing. There's inadequate sewage disposal, incomplete kitchen facilities, and no telephone service. So there's a lot of hardship on the Navajo Nation as well as the Hopi Nation. I'm sure many of us have also asked ourselves continuously, why did it take so long for the VA and IHS to collaborate and provide quality health care to our veterans? Imagine all the possibilities and differences they would have made long ago. The VA and IHS do have a mission to serve veterans, to provide quality health care. So as you'll see here, their mission is to enhance the health of American Indian and Alaska Native veterans through the delivery of quality health services using the strengths and expertise of IHS and VA. So this is not really available online, but this actually started way back in February of 2003, where an MOU was signed by the Deputy Secretaries of Department of Health and Human Services and the VA as well. So here you'll see a timeline of all the work that has been done from way back in 2010. So I tried to be as accurate as I could with these dates here, but we do have October 1st of 2010. That's when the VA and the IHS came together to sign an MOU, which is a Memorandum of Understanding. And then it went on from March through May of 2012, where we came together for tribal consultations and we drafted a national agreement. And THP stands for Tribal Health Program. And then we move on to June of 2012. This is when we have confirmed approach. This is where we kind of knew that it's going to work. This collaboration will succeed. So, and then we go on to August of 2012, and it did start with that Dear Tribal Leader letter, and then it went on to December 5th of 2012, where that national agreement was finally signed. And then it goes from there with onboarding of these tribal health programs. Now, bringing VA care, health care to the Navajo and Hopi nations. So why did we choose the Navajo Nation and the Hopi Nation? Well, we pretty much all know that the Navajo Nation is the largest Native American tribe in the U.S. right now. It is passing, I do believe, 300,000 members. And currently, Navajix does serve over 1,600 veterans in the area. And these veterans reside in Chinle, Arizona, Kayenta, Tuba City, and Winslow, Arizona areas. And we just thought about, the Hopi Nation as well. There are neighboring tribes, so, why not start a collaboration with their tribe as well and start negotiating there? So you'll see that Hopi Nation does have approximately over 18,000 members. As of February of this year, there's currently 376 veterans enrolled with the Prescott VA Medical Center. And we'll go ahead and move on to how did it get started? How did we do this? Well, the very first thing is the driving force behind it is the veterans, okay? The veterans are the ones that have voiced their opinions. They have written letters to their congressional and tribal leaders, and they have just really been advocating for their own hospital. They specifically stated they wanted a hospital, but, that takes a lot of, the enrollments had to be very, very high. We do have the numbers to start a VA hospital but it's not feasible right now because the enrollment users at these sites that we're collaborating with it's very low. You'll see that in the coming slides, but you'll see there a little timeline as well. June of 2009, that's when we submitted a grant to the Veterans Health Administration Office of Geriatrics and Extended Care. And then in 2009 of July, the grant was approved. And in August of 2009, we did establish agreements with Navajo Nation and IHS to come together for meetings. So we started meeting with them, and September 2009 to 2010, we met with the very first facility, and that's the Chinle Service Unit. The Chinle Service Unit has 3 outpatient clinics under them. They have the Chinle Comprehensive Health Care Facility, the Saley Health Care Facility, and the Pinyon Health Center. And the timeline, as you see, is going to go on a little bit more because I did want to include some important dates in there. December of 2010 to March 2011, we conducted the first, second, and third proof of concept clinics. And then we went on in 2011 and 2012. We actually included in our plan to deploy clinical video telehealth in our VA mobile clinic. So you'll see a photo of that really soon here. But clinical video telehealth is the new wave of the future. Okay, we're trying to educate our veterans on the many benefits of this type of care. And this is where we can connect the veteran from one of our partnered sites out here on the reservation to their provider down in Prescott, Arizona. It could be their primary care provider, it could be their mental health care provider, or their social worker. So this really saves them lots and lots of road trips, especially the expenses when they add up, all the wear and tear on their vehicles. So we're very proud of this. And you'll see that it's going on with we just continued collaborating, continued with ideas and ways to bring VA healthcare to the nations. Okay, on this slide, you'll see that the collaborations have an initial 5-year period. Okay, these interagency agreements are good for 5 years, and if everything is going well in both VA and IHS or tribal health facility, if they're both in agreement, we'll go ahead and explore the option to extend or renew. And all of our sites in on Navajo land and Hopi land, they do provide VA healthcare services to Native Americans and also non-Native Americans. Okay, so we have African American veterans coming in. We have Caucasians. We have all different nationalities coming through. And that's because in these communities, we do have educators in the area. We have EMT people. We do have, non-natives that are married into the Native American tribes. So, we do want to include all veterans. We do want to provide VA healthcare services for all of them and to avoid any complaints of discrimination. And to keep these sites going, it does take a lot of work. It does take a lot of meetings, a lot of travel time for myself and my coworker, Rod Sepulveda. We have to meet with our tribal health facility CEOs and their administrators and address any questions, concerns, or work on improvements. So here you'll see photos of the sites of care. In the top left corner, we have the Chinle Comprehensive Healthcare Facility. And on the top right corner, you'll see a picture of our VA mobile clinic. Okay, so this clinic was first parked here at the Chinle Service Unit. It's been here for quite some time, providing primary care and mental health services, as well as clinical video telehealth. So you'll see that satellite displayed there. That's a direct VA network. So we're able to get right into our VA network, into the charting system, into our emails. You know, it's a direct line. So I would say the broadband, the width of it is very, it's nice. It's not your average T1 line. T1 line is like very high speed internet service, but we get the job done there, and it's parked at the Pinyon Healthcare Center. So we're very proud of that one as well. That mobile clinic has been to the Pinyon Health Center. It has been to the Saili Health Center, to the Palaka or the Hopi Indian Healthcare Service, and the Tuba City Regional Healthcare Facility as well. So it's been all over the reservations out here providing VA healthcare for veterans. And then the bottom lower left corner, we do have the Kayenta Healthcare Center. And this is a IHS facility that, it's its own service unit. Okay, it's not like the Chinle service unit where Chinle has Pinyon, Saili, and Chinle underneath it. So Kayenta is its own service unit, and that one opened up, I believe last year in July is when it finally opened its new doors. It's a brand new facility. We're very, very proud to be partnered with that site too. We do have three VA rooms that they gave to us inside of their facility. So our VA staff and provider and pretty much the VA healthcare providers do have access into their IHS charting system. So they're all credentialed in there as well. The same for Chinle. The Chinle site, that one has about five exam rooms. We have one check-in window where our veterans come in and check in and check their enrollment and eligibility. We have a room for the VA provider. We also have a screening room for the registered nurse. We have another room for clinical video telehealth, and that's for mental health services, or if our veterans need to, we'll save them a road trip and have their first initial consultation for specialty services. We'll go ahead and have it here on site. And we have one more office, which is for, the social worker. And the bottom right corner is our Tuba City Clinic. And this is located inside of the Tuba City Regional Healthcare Corporation. And we're very proud of that site as well. And that one just has two rooms, one for check-in and screening, and then the other for the VA provider and the clinical video telehealth. Okay, so there's one photo that I really wanted to include in here, which was the Hopi Healthcare Center, but I just couldn't squeeze it in there. I should have at least done that, but we'll go ahead and move on to the next slide. So here you'll see some data, current VA enrollment and reimbursement data on each site of care. Okay, so we kind of broke it down, and we also included Peach Springs in there, and Winslow, and Native American cardiology. So don't mind the typo there on cardiology. I apologize for that. but you'll see the number of veterans residing in those areas, okay? And you'll also see how we broke it down from fiscal year 2013 to 2016. Okay, so out of all those sites, you'll see there that Chin Lee service unit has brought in that much revenue. That is a lot of money. And we really, really commend their business office for, staying on top of those claims and really getting the veterans, reaching out to the veterans, too, in their facility and, getting them enrolled, explaining to them the benefits of enrolling for VA health care. So we're very proud to be collaborating with all sites. And you'll see at the very bottom, we have saved many veterans lots and lots of mileage. Okay, we're very proud of that as well. And I really wanted to include a map of the whole Navajo Nation and Hopi and just kind of show how much mileage, how much distance is between each site and as well as Prescott. Okay, we'll go ahead and move on to the next slide. Okay, so what kind of VA healthcare services are available for veterans? Once a veteran is enrolled, there is a variety of healthcare services they can choose from. It ranges from their basic primary care to nursing home care. And it just depends on which site the veteran receives their health care. But the mode of, or the delivery of health care, it varies, okay? So face-to-face, this is where the VA provider is on site and they meet, in person with the veteran. And the only site right now that has this face-to-face service is the Chinle VA Clinic, which is located inside of the Chinle IHS Hospital. And the reason for this is because this enrollment, the VA enrollment is very high at this site. We're about 300 to 400 veterans that use the clinic on a regular basis. They have actually, opted to choose VA as their primary care team. So it does happen back and forth. There are veterans that, they switch from VA primary care and then they want to go back to IHS. So sometimes they're a little hesitant. Sometimes they feel comfortable with just seeing VA only. But we do encourage them, you need to choose one primary care team. It will avoid duplicating prescriptions. It will avoid duplicating consults. We do try to educate them on that as well. And then we have telemedicine. Telemedicine, like I said, is the new wave of the future. A lot of our younger veterans are embracing this new form of technology. They're embracing it very much. Not so much the elderly veterans. They just don't see any benefit of receiving primary care or mental health care via satellite. But we'll continue to educate them. That's our goal. We'll also continue, educating them on the benefits of using telemedicine. So, and then the third option is telephone encounters. So telephone encounters is where the veteran and the provider discuss the veteran's health care by phone. So say, for example, if a veteran comes into the clinic and they get their labs drawn or imaging done, usually the provider will want to save the veteran a road trip and just give them a call by phone to discuss the results. This has been very, very beneficial, especially for the ones that live greater than 30 miles out from the nearest VA clinic. So they like this as well. And just wanted to point out, too, that at each site, it's required that we have a registered nurse and a licensed practical nurse on site. Okay? Also joining the team are certified medical assistants as well. So usually the veterans care, the care team consists of the provider. The provider could be a medical doctor, a nurse practitioner, a physician assistant, and then you have your nursing team as well. Okay, so you'll see here all the services that are provided pretty much at each site of care. Okay, so there's a long list there of services, as well as addressing changes that they can do, immunization, serum removal, they do health screenings. The one we're most proud of is mental health. We're trying to get that one moving along. We're trying to get veterans, enrolled and really use the service. And like I said, mental health is mostly done via telemedicine. But if the veteran doesn't want that, we do give them the option that the nearest VA clinic they can go to is in Flagstaff, Arizona. And that's where we have a psychiatrist that does travel out from the Prescott VA Medical Center to Flagstaff and provide face-to-face services there. And then on the other side, you'll see ancillary and other services available at IHS and Tribal Health Program facilities. So when I speak of this whole listing here, this is where the VA provider, during the visit with the veteran, since we have this space shared agreement, this collaboration, we do use most of the IHS's ancillary services. So if a veteran needs his labs drawn, if he needs radiology services, physical therapy, the VA provider will enter the consult into the IHS system. And you ask, well, how? Well, like I said, all VA healthcare staff are credentialed in the IHS system and the Tribal Health Program system as well. So they do have access to their charting system. So you'll see that the VA provider, the VA healthcare team doubles their work. It's not permitted to copy and paste anything. So usually all of the care that's provided is on the VA healthcare note, and then the provider would go ahead and open up an IHS encounter and just do a little AMP there, which is the assessment and plan, and then go ahead and order the consults through the IHS system. And that's the way that the veterans will receive their health care. So we're very proud to collaborate, like I said. And I'm not quite sure if you guys can all see this, but I wanted to put together a little algorithm here. So you'll see delivery of VA health care. So I'm going to kind of break it down for you. So this is when a veteran presents to any of the VA clinics. Okay, so they're coming here, they're requesting for VA health care. It's VA's responsibility, as well as IHS, to verify their enrollment and eligibility. Okay, so the IHS, they have to see if the veteran has a chart in their IHS system, and if not, they usually get them enrolled right then and there. I do believe the documents they do require is birth certificate, Social Security card, health insurance information, a certificate of Indian blood, and a copy of their DD Form 214 too, which also verifies that they're a veteran. So these are just a few items that I know of that they request if a veteran will be using their health care facility. So IHS and VA will come together to verify enrollment, and then a VA appointment is made for the veteran. If the veteran is very new to the VA, we usually schedule them a 1-hour encounter with the VA provider, and this will be the very, very first new VA appointment with the team. It will include a complete history and physical exam, definitely with the medication reconciliation there as well, because the majority of veterans that do come to the VA clinic, they come from other tribal health care facilities, and they have, a list of medications already going. So we must do medication reconciliation as well. And during the visit, the VA provider will go ahead and enter orders. And if the veteran only wants services in the VA side, the VA provider will go ahead and order ancillary services or specialty services only in the VA system. Okay? And those consults will either be in-house meaning that it's going to be at the main Prescott VA facility or the nearest VA clinic wherever they can get the service done, or it could be an outside referral, okay? An outside referral would be, say, for example, if the veteran needed orthopedic services or if they needed to see a dermatologist, we'll go ahead and generate an outside referral, which is called a non-VA care consult. Okay, you'll see that down there in that triangle on the bottom left. So the consult, once it reaches the Prescott VA facility, there's a department there that's called Community Managed Care, and they're the ones that determine how to handle the consult, the VA consult. It'll either be a choice consult or a non-VA care. The choice program, I'm not quite sure if you guys have heard about this, but the choice program, there's good sides to it and there's downsides. The downside first is, Congress went ahead and came out with this pilot program to get veterans off of waiting lists. They didn't want veterans on waiting lists anymore. So they came up with the Veterans Choice Program. It basically provides eligible veteran services. They get access to primary care, inpatient, and outpatient specialty services, as well as behavioral health care. And the way that a veteran qualifies is there's 3 areas, I believe, that a veteran can qualify. If they have to wait longer than 30 days for a VA medical appointment, the choice program will be an option for them. They can opt into that program to get faster services. And then we also have another criteria that they could be eligible for choice is if they live greater than 40 miles from their location of home to the nearest VA clinic. Okay? So pretty much all of the veterans that live in rural areas, especially on Navajo and Hopi lands, pretty much all of them do qualify for choice program. So a lot of them have been using it. They have been opting into it to receive their specialty services. And then the non-VA care is if choice can't pick up the consult and cover the cost for that, non-VA care will kick in next. Okay? Non-VA care is given, it goes through a medical review, and it goes through a team of doctors and nurses, and they kind of just assess the whole order and the patient's condition, and then they either approve it or deny it. Majority of the time it is approved. That's very nice. So that once that non-VA care is approved, they get an authorization for the service, and the veteran can see any provider of their choice. And just as long as that provider accepts the authorization from the VA, then they'll go ahead and take on the care from there. And then let's go back to the VA side again. So another form of a consult would either be through pharmacy or through mental health services. So just kind of wanted to highlight that there. And then if the VA provider enters an order through the IHS system, and if they're requesting ancillary or specialty services, you'll see there that labs, radiology, and audiology do require a prior authorization. And this is needed because the IHS or tribal health program facilities do require a prior authorization number and a period of validity, I believe. And this information is needed so, they can help, it'll help them process their claims for reimbursement of services rendered. Okay, and then we'll go ahead and I'll look down further below those two square boxes there. And, since the veteran is getting his care at IHS and we're getting ancillary services done in their facility as well, we have an agreement to provide a copy of the VA encounter note. Okay, this is very, very helpful for the coders and the billers to code and bill properly. So the interagency agreements do cover these as well. In the next slide are ways that VA and IHS, BHP, co-manage the veteran's care. Okay, so you'll see there that a veteran and a provider do work together in the veteran's health care. So let's go ahead and take this as an example. If a veteran shows up on the on the IHS or THP side for a primary care visit, and if the veteran's care is needing a referral for specialty services, of course the IHS and THP will look into their health care coverage, and they'll see what is available to cover their care. And they'll also look at their purchase referred care system as well. And if none of those cover the veteran's care, then the IHS provider and the veteran do present to the VA clinic requesting to co-manage. And that's when a VA provider is more than happy to assist in this. Again, like I said, the VA has to verify enrollment and eligibility. Every veteran that comes through the clinic, we must verify enrollment and eligibility. They must be enrolled to receive VA healthcare services. Okay, so if the veteran is not eligible for VA healthcare, the VA provider will then refer the veteran back to the IHS PCP, and they'll have to work with their PRC and patient benefits from there to explore other options. And if they are enrolled, then the IHS provider and the VA provider come to an agreement, and they communicate very closely to discuss a care plan, which will definitely include a medication reconciliation, because we do not want to duplicate any medication. That's very, very dangerous. And from there, the VA provider will order the consult in the VA system for the specialty care service needed, and that's when VA takes over that consult. So when we take over that consult, the VA picks up all costs of that care. Okay, it has to be for that duration of the consult's care. And since we're collaborating again and co-managing, we must provide a copy of the VA notes to IHS as well. So when we provide VA notes to IHS, what they'll normally do is they have a scanning system. Pretty much their medical records are all electronic, so they'll go ahead and scan in the VA notes into the veteran's IHS medical record, and it's available there for view only. Okay, so these are two algorithms on how we manage the veteran's health care. Okay, so this is a question that we get all the time. Some veterans, don't agree with VA being here. They pretty much have their own reasons and beliefs, and we must still treat them with respect and answer all of the questions the best that we can. So they're always asking, why should I enroll? I get my health care free all the time at IHS. And this is where we really have to educate them again and guide them through the whole process. We do let them know that, there's many benefits. It saves them a road trip. There's no enrollment fees, no monthly premiums, no deductibles. Some veterans, just a very few, have copays, okay? This is when their income exceeds the VA income household threshold, it's called. And these are veterans with very high income, and they're the ones that are hit with the copay. It's not a lot. It can range, okay? So copays for medication are around about $8 or $9. I'm just throwing numbers out here. Specialty services, I believe, is around $50 or so. And every veteran that enrolls has a unique, comprehensive VA healthcare benefits package. Okay, so it'll include outpatient care, hospital care. It'll include specialty services, mental health services. So it varies from veteran to veteran. Okay, and we also try to encourage them to get the word out. If you're eligible for your state Medicaid, you're automatically eligible for VA healthcare benefits as well. So we do let them know that their VA healthcare benefits is another option, another way of receiving healthcare. It's just another benefit for them. So you'll see all of these listings here, and the one that we do try to touch on too are the VA-rated service-connected disabilities. We do treat those for free. So if a veteran presented to the clinic and he's service-connected for diabetes or hypertension, or if they've had some kind of shrapnel or encountered some kind of explosion that, left them with one leg or one arm, they'll definitely get VA health care for free. Okay? So we do, like I said, explain as much as we can to them, and we also try to point out that VA does specialize in PTSD, military sexual trauma, depression, and we do have programs for suicide prevention. We do help homeless veterans as much as we can. We also have telecare, and telecare is our 24-hour, 7-day-a-week telephone line that they can call, and there's always a registered nurse available for them to speak to. And we also have caregiver support program, which is where VA helps a family out. Say, for example, if a veteran is disabled and they need a care provider in the home, if they wanted a spouse or a family member to care for them, then we'll go ahead and refer them to the caregiver support program, and they'll work with them from there. And usually the caregiver does get paid for providing care to the veteran as well. So there's many benefits to enrolling for VA health care. All right, and the challenges we face. Every day we have challenges in keeping these clinics operating. Okay, like I said, copays is definitely one of them that we hear out there at these veteran meetings. They don't want to use the clinic because of copays. They don't want to pay for their care. They feel that they're entitled to free VA health care. And, we do agree with them, but it's just what, Congress sets for the rules and regulations of VA health care. Transportation is a huge one, definitely, since we're so remote out here. We don't have any shuttle right now, any VA shuttle to pick up veterans at their appointment and take them home. We don't have any of that available right now, but we do tell them that it is an option that they should consider in the future, but the numbers have to be up. We have to have about, I think it was around approximately 500 to 600 enrolled veterans, using the clinics on a daily basis, and then we'll go ahead and explore bringing a shuttle out to the reservation. So it's really tough to keep these veterans, enrolled and keep them utilizing the clinic. And you'll see here, too, that we do encounter some network connectivity issues. We do have it's called a T1 line, and that's a direct VA line that's coming through the IHS facilities, and it allows us to get right on the VA network. We don't have to go in remotely or anything like that. So we do have network connectivity issues. It's not a lot. It's, I would say, maybe twice a month or so. The other concern, too, is veterans don't want to use the clinic because of HIPAA violations. Either they have, a family member working at the IHS facility and they don't really trust their VA records in their hands. So that's another complaint that comes up, that they just don't trust the collaboration, regarding that issue. And this pretty much happens everywhere. Cell phone connectivity issues, veterans changing their phone numbers, or they don't have signal, or they don't have enough money to, put more minutes on their phones, or if they, moved and they don't keep their demographics up to date, it makes it very tough to get in contact with them. So these are just a listing of all the, challenges that we face every day, but we just got to keep pushing forward and keep providing the care that they deserve. Okay, and here's another one too, sharing of medical records. It is in our interagency agreements and our MOUs that we, need to share medical records because it's services that are rendered to veterans from the IHS facility because we use their ancillary services. So you'll see that I pretty much explained this earlier, that our VA providers are credentialed in the IHS DHP facilities, so that way we can, collaborate and co-manage. And you'll see there that all mental health records are off limits. Okay, nobody can get into these unless there's an emergency situation, such as a crisis, and we'll definitely need to, release the most recent mental health notes to the team that is caring for the veteran. And veterans may request for copies of their primary care notes, as well as the mental health notes, and we usually just have them go through the regular process of signing a release of information and, getting them a copy of those notes. The majority of the time they want a copy for, compensation and pension claims, or if they want to just have it for their own records. Okay. And that pretty much sums up the main points that I wanted to talk about in this webinar.
Excellent. Thank you so much, Shandine. We're going to move now into our question and answer period, and I am already seeing questions coming in through the Q&A box, but for anyone else who has a question that you haven't submitted, I want to direct your attention to the box in the bottom right-hand corner of your screen, and you can type your question into that white square at the very bottom, and we'll receive it. So thanks, everyone, for the engagement that you've had so far. We have a lot of questions coming in, and we will do our best to move through those. The first one is related to the question you were just talking about, Shandine. Ron asks, will the VA also share their electronic health records with tribal health programs?
It depends on which site we have an agreement with. If it's, it depends on which site we have an agreement with. It's not all tribal health program facilities. If that's the case, then usually we'll have the veteran, if the veteran wants to share their VA healthcare records with that facility, we'll have them go through the process of filling out a VA release of information. Or if the IHS is requesting VA notes, or the tribal health facility is requesting VA notes, they'll need to go through their process of filling out their facility's release of information, and that's on obtaining notes.
Okay. We have a couple.
It's not available to all tribal health program facilities.
Okay. There are a couple questions now related to different elements of reimbursement. The first one is, are you able to get reimbursement for telemedicine and telephone encounters?
That is a great question. I do believe, for telemedicine and for telephone encounters, I don't want to give a definite answer, but I do believe so. I would have to look into that a little bit more. I know they only get reimbursement for direct services of care. I'll have to definitely get back to that gentleman on that one. I just want to make sure that I answer that correctly for telemedicine and telephone encounters.
Okay.
I need to make sure that it's the form of direct services of care.
So we'll look into that and see if we can provide a little more information later after today's webinar. Another reimbursement question is, the audience member asks, so how does reimbursement work? Is it VA reimburses IHS for the care provided by IHS? And are the providers at the IHS and to the city sites employees of VA?
Okay. So let's go with the first one.
Mm-hmm.
It's about reimbursement between facilities, right? Can you repeat that first question again? I'm sorry.
Yeah. The question is, so is it that VA reimburses IHS for the care that's provided by IHS?
Yes, ma'am. Yes. Mm-hmm. That is a form of direct services of care. So if a veteran is enrolled with VA and they're getting services on the IHS side, the VA must reimburse the IHS for taking care of that enrolled veteran. And it's at the all-inclusive rate of, I believe, around $360.
Okay. And the next part of that question is related to the providers. And the question is, are the providers at the IHS and Tuba City sites that you're familiar with, are they employees of VA?
They are not. We have our own separate VA healthcare team, and so there's the tribal health program site. So we don't share providers. We have our VA care team taking care of the veterans, and vice versa. We don't. We co-manage. This is where if the IHS site refers a veteran to our VA clinic, we'll go ahead and co-manage and take over the care from there. or vice versa. But there's no tribal health program providers. They do not work directly for VA or in the VA clinic.
Okay, thanks. So we've got a couple different questions here about how this collaboration began, and also people who are wondering what steps should they be taking in their own communities. So overall, can you talk about how long it took to establish the agreements that you have in place and a little bit about the process of that? And what would your recommendation be for someone in a different area where these agreements don't exist yet? What steps should they look at taking first?
That's a great question. I like it. Okay, so depending on the place, depending on the veteran population, it's really veteran driven. Okay, if the veterans do want a VA, IHS, or THP collaboration, they really need to, step up and voice their need instead of driving hundreds and hundreds of miles to the nearest VA clinic or VA healthcare facility. And the way I know of exploring options of collaboration with other facilities, it's good to contact the Office of Tribal Government Relations, and I'll go ahead and state their phone number. I do believe they have an email address. There's an email address for further inquiries on VA and IHS collaboration. Let me just go ahead and make sure I give you guys the correct web address, okay? Hold on just a minute.
And as Shondine's finding that information for us, I'll type it into the welcome box that's in the right-hand corner so folks can look at it and copy it down if you need to. I'm also going to take a brief moment to say that our plans for the next webinar in this series, the webinar that's happening 1 month from today, is going to be with several tribal government relations regional specialists from the Office of Tribal Government Relations. So they are the VA office in charge of tribal relations, and they'll be able to talk with us about how they make connections in their areas, how they facilitate these connections and agreements, especially related to health care. So there will be more information on that coming up in our next monthly webinar.
Okay. Just a minute here. I'm so sorry. I'm trying to get this loaded here. I want to give the correct web address, like I said. All right. It's just about done loading here. Okay. So it's going to take... So for inquiries about how to get this whole program started, you do definitely want to contact, here's the email address. It's tribal, TRIBAL .agreement, AGREEMENTS @va.gov. And there's a member of the VA IHS Tribal Health Program Reimbursement Agreement team that will return your email within 2 business days.
Great. Thank you for providing that. Go ahead.
Yeah, definitely. But it really is veteran-driven. That's how we got these clinics going out here, because they really, really stressed it to their tribal leaders, their congressional leaders, and, we had to do something about that. So, but definitely contact the Office of Tribal Relations.
Okay. So thinking about your area again, one of our audience members asks, is there any work being done to expand these services to Shiprock, Gallup, Crown Point? Is there any collaboration with Albuquerque VA Medical Center?
Great question. We get that all the time. Our collaboration out here with these IHS facilities is in the state of Arizona. Okay, so we cover all of northern Arizona, which includes a lot of the, the communities of the Navajo tribe and the Hopi tribe. So for partnerships out in the New Mexico area, they would have to work with their Albuquerque VA Medical Center on that. I'm not quite sure if they have a rural health program at the Albuquerque Medical Center, but that's definitely something that they should explore. But for the Northern Arizona VA healthcare system, we cover all of Northern Arizona only.
Okay. Well, we still have a few more questions in the Q&A box, but we're nearing the end of our time. It's almost the top of the hour. So I want to say, Shondine, do you have any final comments you want to give to us as we're wrapping up today?
I do. I want to also share that this webpage has been very, very helpful, and I do refer to it from time to time because I think the information in there does change. It is under, if you can even Google it, it's under VHA Office of Community Care.
Is that the address?
VHA website.
Okay, VHA Office of Community Care.
See if I can get the direct address here. It's because it just kind of goes on in that web address. But it's under www.va.gov and /purchased care /program.
Okay.
Okay, and in there you should be able to come to the VHA Office of Community Care that talks a lot about the IHS and PHP Reimbursement Agreement Program. There's some frequently asked questions in there. There's also the IHS all-inclusive rate from 2016, and it kind of goes more into detail about the VA medical benefits package. So I find that website very helpful.
Great. Thank you for giving us those resources of where to start and what to look up. That's very useful. So,
yeah, and I just want to add one more thing too. Is I'm not quite sure who the liaison would be in the tribal communities where the audience is from, but it's really good to get together with their local veterans organization. I'm not sure if they have those in their communities, but we refer a lot of our veterans there to their local veterans organizations because those organizations are in collaboration with their tribe as well and with their local, I don't want to say chapter houses, but on the Navajo Nation we have these chapter houses that govern all of our communities out here. So the best place to start, too, is at those veteran organizations because I'm not sure if some of them are part of the American Legion or the VFW, and it really starts with the veterans. It really has to be veteran-driven because it is tough to keep up these numbers at these clinics. Sometimes our numbers go up, the enrollment numbers, and sometimes it goes down. And when it goes down, that's when we're just, we're really, really trying to figure out other alternatives to get them to use the clinic because we don't want these clinics to go away. We want to stay here and keep providing health care closer to home.
Great. Well, thank you so much for that picture of the benefits and the challenges and just the specific story of what things look like in your area and your VA and the communities that you work with. It's a really helpful example for people in other areas to consider. So that is the conclusion of our time today. Shondine, I want to thank you so much for being our presenter today. We have learned so much from you. For our audience members, I want to remind you that if you're interested in receiving a copy of these slides, please send us an email at ltssinfo@ kaufmaninc.com. That email address is written down in the welcome box in the upper right-hand corner of your screen. And you can also send any future questions that you have to that same email address, ltssinfo@kaufmaninc.com. In closing, I'd like to remind everyone that today's webinar was recorded, and the recording will be posted online in the near future at cms.gov on the Long-Term Services and Supports Technical Assistance website that's there as a part of cms.gov. I would also like to remind everyone that today's webinar was part 2 of a 3-part series on veterans. So the recording of part 1 is available on cms.gov, and please consider joining us for the 3rd part, which is going to take place a month from today on March 22nd. It will feature the Office of Tribal Government Relations and their regional specialists. Thanks again, everyone, for joining us today. This is the conclusion of our session, and you may disconnect now.